At this moment, I want to welcome Elizabeth Kelley, who is the Executive Director of the Electromagnetic Safety Alliance in Arizona, and her colleagues to the council meeting to talk about the need for federal policy and guidance to address environmental toxins existing in healthcare facilities and in housing. As I mentioned previously, these toxins in the form of electromagnetic smog and fragrance chemicals that have a devastating neurological and physical effect upon persons with electro and fragrance sensitivities. The effects can be life-threatening and can preclude persons from obtaining much needed healthcare, oral care, and other health-related services. Ladies, I yield to you and welcome.
Thank you. Is Susan Malloy on the call? Susie?
Susie?
Could you unmute yourself?
Hello.
You can start, Susan.
Wait. Oops. Hello, my name is Susan Malloy. I'm a white woman in my mid-70s. I use she and her. My disability began in earnest by my late 20s. It is neurological and immune in nature. I live in the remote high desert of northern Arizona, between Navajo Nation and the White Mountain Apaches. Now a few opening words. To National Council on Disability and Chair Gallegos, thank you for this opportunity. It means more to us than you'll ever know. To the dynamic, persistent visionary coordinator of numerous of our efforts for the last 35 years, Director of the National Center for Environmental Health Strategies, Mary Lamiel, we thank you. And to the hundreds of people we know, and the thousands or millions more we don't know yet, who live and die with this disease, our most sincere thanks from the heart to all of you. But I'm entrusted to speak of our urgent needs to the council. I only hope to do you justice. I now have the honor of introducing Dr. Magda Havas. Dr. Havas.
Thank you very much, Susan. Could I have the next slide, please? I'm a 70-year-old white female with silver hair and hazel eyes, and I'm going to be talking about the problem, past, present, and future. Next slide. I'm going to present an historical overview of electrosmog and electrohypersensitivity. Here we have a graph of various inventions from 1900 to the present, showing electromagnetic exposure along the y-axis and time along the x-axis. It all started with electricity and the telephone exchange at the turn of the last century. We then had radio in the 1920s, radar in the 1930s, television in the 1950s, and the microwave oven in the 1960s. Then within a 40-year period from 1970 to 2010, we saw the invention of computers, cell phones, cell phone towers, fluorescent light bulbs, Wi-Fi, solar and wind power generation, and smart meters. All of these emit electromagnetic pollution. As of 2020, we experienced the 5G rollout and the Internet of Things, which is still progressing. With each invention, there were health effects that generated similar symptoms with different names. Next. The first was neurasthenia, or a weakening of the nervous system with switchboard operators, followed by microwave illness or radio wave sickness experienced by radar operators during the Second World War. In 1980, the term electrohypersensitivity was introduced. And in 2004, the World Health Organization recommended that the term idiopathic environmental intolerance attributed to electromagnetic fields be used instead. Currently, electromagnetic illness is commonly used, which is EMI, or electromagnetic injury for legal cases. All of these are referring to the same illness. Next. Electromagnetic radiation is a form of air pollution. Here we compare smog that is chemical with electrosmog that is electromagnetic. Black silhouettes represent stationary sources like smokestacks for chemical pollution and antenna farms for electromagnetic pollution. We also have mobile sources like cars that generate both chemical and electromagnetic pollution. Indoor air quality involves both chemicals and radiation. Behavior like smoking and talking on a cell phone, as well as wearables like perfume and smart watches, and especially hearing aids, expose us to this pollution. Next. Electrosmog exposures are increasing exponentially. Here we see a world map showing a few purple dots in North America and Europe that are Wi-Fi hotspots in 2005. Within 15 years by 2020, next, Wi-Fi hotspots have spread across the entire planet. This map does not include 5G, smart devices, or cell towers, so is an underestimate of our current electrosmog exposure. Next. Common symptoms of electrohypersensitivity include difficulty sleeping. Note that all the symptoms I'm talking about are represented by cartoon characters. Chronic fatigue, chronic pain, often starting with headaches, mood disorders, cognitive disorders, visual disorders, hearing problems, mostly ringing in the ears, movement difficulties like dizziness, skin problems, and eating problems. Next. These disorders are associated. Electrohypersensitivity is an environmentally induced disability, and electrosmog is a neurotoxin. So it should not surprise anyone that electrosmog contributes to neurodegenerative disorders. I write about this in a paper published in 2019. These disorders are associated with adults and the elderly. They include, next, Alzheimer's disease, dementia, neurodegenerative diseases, amyotrophic lateral sclerosis, Parkinson's, and multiple sclerosis. Next. And these are normally associated with young people. They include attention deficit hyperactivity disorder, autism spectrum disorder, cognitive disorders affecting concentration, memory, and learning, stress response, mood disorders like anxiety and depression, and fetal exposure and effects on offspring. Next, we know that electrosmog triggers the symptoms of electrohypersensitivity, but what causes electrohypersensitivity in the first place? We found that there are common precursors for EHS that may be causal in nature, and these include physical trauma to the central nervous system, as represented by a drawing of a head injury. Number two, chemical exposure, as shown here with mercury fillings. Number three, electrical exposure consisting of multiple shocks, acute or chronic exposure. Biological trauma in the form of tick bites leading to Lyme disease, for example. Number five, impaired immune system that is common among the elderly and the very young and those taking certain medications. This information is critical for doctors treating patients with electrohypersensitivity, as the treatments would be based on the precursor involved in that sensitivity. Next. How many people are affected by electromagnetic hypersensitivity? According to a paper by Michael Bevington, published in 2019, 0.64% of the population can't work, 1.5% of the population have severe symptoms, 5% have moderate symptoms, and 30% have mild symptoms. Our research confirms the 30% for mild symptoms, but the severe symptoms may be an underestimate. If we use Bevington's values for the United States, that has a population of 331 million, then 2.2 million people can't work. 5 million are severely affected, and these two categories qualify as disabilities. 16.6 million have moderate symptoms, and almost 100 million have mild symptoms. Clearly, electrosmog has the potential to adversely affect a very large population. Next. The time to act is long overdue. By 1971, the US government was aware of the harmful effects of radiation, and they published a report citing more than 2,000 scientific studies that documented harmful biological effects attributed to radiofrequency radiation. These papers are available on the zoriglacier.com website. In 2015, 240 scientists from 44 countries signed the International Scientist EMF Appeal submitted to the UN and the WHO. Recently, manufacturers are telling consumers to keep devices like cell phones at least 1 inch from the body. And as of 2015 and possibly earlier, insurance agencies stopped insuring against radiofrequency health effects. In 2012, the American Academy of Environmental Medicine stated that our radiofrequency guidelines are inadequate to protect children. And recently, governments in various countries are removing and replacing Wi-Fi in schools with fiber optics, which is a far superior technology. Next. Here we have 6 able-bodied cartoon characters of different heights who are standing in water. The height of the water represents their electrosmog exposure. 2 of the shorter characters are submerged, and this represents electrohypersensitivity. This is where we find ourselves today. What does the future hold? Next, if we do nothing about radio frequency guidelines, if we allow Wi-Fi everywhere, schools, parks, public transit, hospitals, etc., if we allow smart meters, smart appliances, and smart homes, if we have 5G everywhere, including driverless cars, and if we have wireless wearables, next, then our exposure is going to increase and many more people will be adversely affected by this radiation. Alternatively, if we establish radio frequency free zones or green zones similar to smoke-free environments, if we lower radio frequency guidelines, if we have wired routers everywhere, including schools, if we use wired smart meters, smart appliances, and if we place a moratorium on Wi-Fi, then our future looks much better with lower exposure and fewer people adversely affected by this radiation. My mantra is, if it doesn't move, it doesn't need to be wireless. Next. The future depends on us and how the National Council on Disabilities and other agencies respond to this issue. Now I would like to turn it back to Susan Malloy. Next. Thank you.
Thank you, Dr. Havas. Now, there are a few points I'd like to share with you concerning urgent, unaddressed elements of the access we need and to which we have been guaranteed by law and by principle, as they are for people with all disabilities. To begin, elements of equity in healthcare. Eliminate fragrance in all forms and adopt safe, fragrance-free cleaning products for medical facilities. This includes fragrance disseminated through the heating, ventilation, and air conditioning systems, the stick-ups, the plug-ins, and the feds, or fragrance emission devices and systems in restrooms, medical offices, clinics, and treatment areas. Install signage and pictograms in pertinent areas to designate the safest, for us, wheelchair accessible areas for parking and all other elements of the path of travel, including entryways, halls, waiting rooms, classrooms, examine treatment areas, and the wired telephones. Next, hardwire buzzers and intercoms at the facility entries so we can summon staff outdoors or to the lobby for our paperwork, to assess our vitals if required, and to escort us if we ask to the safest waiting and exam rooms. Provide daylight through windows and skylights to areas we are meant to occupy, so fluorescent lights can be eliminated. Do not install the new Wi-Fi devices through which to detect air pollution. They will address contaminants of only one kind, using a technology which may add contaminants of a kind that is equally dangerous, electromagnetic fields. During construction or renovation, install separate electrical wiring with kill switches to our safer areas so we have a safer room without shutting down equipment in the entirety of the facilities. Install metal-free fiber optics and Ethernet connections to our EMF safer areas. Next, transportation. We call on designers and manufacturers of transportation vehicles and terminals to shield electrical components of all vehicles designed for easy adaptation and retrofitting. Facilitate removal of electronic and Wi-Fi components. Allow them to be fully disconnected and replaced with safe alternatives. Modular, if that works for simplicity. Shielding of similar kinds is done routinely for military equipment and overseas banking, for example. Designate low EMF, fragrance-free seating for passengers in airplanes, trains, metros, and buses. Provide for these safety measures for our service animals as well. It is critical that they remain safe, sharp, and attentive. The fourth topic I'll touch on just briefly is application of the Federal Fair Housing Act. We request that training procedures be put in place for HUD decision makers and staff now, from the top to the bottom, about what constitutes accessible housing and modification, appropriate funding opportunities, and enforcement mechanisms for us under the Federal Fair Housing Act. We urgently advocate accessible housing for all low-income people with all disabilities, most particularly at this time for those who are functionally impaired due to chemical and EMF exposures. With that, we'll hear from Sheena Symington, Director of the Electrosensitive Society of Ontario. Sheena.
Thank you. Thanks so much for the opportunity to speak with you today. I'm a white woman in my early 50s, and I have hazel-colored eyes and long light brown hair that's getting more and more silver highlights each day. Providing access to those with environmental sensitivities. The Accessibility for Ontarians with Disabilities Act requires a fully accessible Ontario by 2025. This includes environmentally induced disabilities such as EHS and chemical sensitivity. The City of Peterborough, Ontario has an electromagnetic hypersensitivity tip sheet, which is used to accommodate those with EHS during meetings. Examples from this tip sheet include eliminating all wireless devices and the use of natural lighting rather than fluorescent lighting. We have been successful in helping hospitals provide EHS accommodation, including a 6-week inpatient visit for cancer treatment, emergency room visits, and also for diagnostic assessments. We need to create chemical and radiation-free spaces similar to how we have created smoke-free spaces. Next. It is important to treat the environment. In order to provide access, we need to eliminate electrosmog. To effectively reduce exposure, you must first measure it. User-friendly handheld radio frequency meters are readily available, and please visit my website, www.electrosensitivesociety.com, for tips to electromagnetic hygiene. The publication entitled the 2016 European Guidelines for the Prevention, Diagnosis, and Treatment of EMF-related Health Problems and Illnesses recommends, and I quote, the primary method of treatment should mainly focus on the prevention and reduction of EMF exposure. If a detrimental EMF exposure is reduced sufficiently, the body has a chance to recover and EHS symptoms will be reduced or even disappear, end of quote. Next. Practical steps to provide EHS access within hospitals, schools, dentist and doctor's offices, includes measuring the environment and eliminating sources of electrosmog. Within schools, a radio frequency meter is provided to the teacher. Within hospitals, the meter should be provided to the occupational health and safety officer. By translating the wireless signals into sound, this radio frequency meter identifies the sources to eliminate rather than the student or patient having to do so. Mobile wireless devices are turned off or placed into airplane mode with Wi-Fi and Bluetooth off, and the Wi-Fi routers are turned off. In one school situation, the Wi-Fi router was turned down to 16% power, which allowed continued function, but the radiation emitted didn't negatively impact an adjacent classroom. Wi-Fi is replaced with wired internet access, such as fiber optics or shielded Ethernet cabling. Many hospitals already accommodate chemical sensitivities, and currently 8 hospitals in Ontario also accommodate EHS. We hope to make these EHS accommodations a province-wide policy. Often an obstacle to providing accommodation with those with environmental sensitivities is that facilities are unaware of how to provide this type of access. We want to make this how-to process easier for hospitals and other medical facilities. Next. We have documented the steps required to provide access within a hospital setting, and they are also available at www.electrosensitivesociety.com. Finally, there is an urgent need for housing. We need low EMF, chemical-friendly, and mold-free housing. Next. One cost-effective approach would be to maintain underserviced areas. For example, where there currently are no cell towers, keep these areas free from cell towers. Next. Many people with environmental sensitivities opt for mobile housing, as these homes can be easily moved if a cell tower goes up next door. However, zoning bylaws and the cost of land can limit placement of these tiny mobile homes. Upon an initial diagnosis, many individuals must give up their homes in order to reduce their electrosmog exposure. Next, we need to establish low EMF emergency shelters within each community to provide a safe place for individuals to go until more permanent, affordable housing can be obtained. Next, many are unable to work due to this disabilities. Others become homeless and are forced to live in their cars in order to avoid exposure. Next. Over the last few years, outdoor living options have been further compromised due to COVID closures of camping facilities, eliminating the option of showers and washrooms. Again, there is an absolute critical need to create safe, affordable housing options for those with environmental sensitivities. Thank you. I'll turn it back to Susan now.
Thank you, Sheena.
Hello, my name is Elizabeth Kelley, and I am a mid-70s white woman with white hair and hazel eyes. I'm wearing a blue and white print blouse. I highly commend the Council for your visionary health equity framework. It is a game changer. We sent you a timeline before we made this presentation on proposed or enacted public policies that date back to 1968 relative to this category of disability. Up until 2005, the National Council on Disability and the U.S. Access Board did recognize that the environment can induce chemical and electromagnetic sensitivities that are disabling. We are heartened to see that disabling effects of chemicals is recognized by this framework and by other federal policy proposals. But the disabling effects and the civil rights of people who are sensitive to electricity and wireless technologies continues to be ignored. And I want to credit Mr. Gallegos in his opening statement for recognizing these unmet needs. Therefore, we have some recommendations. First of all, we recommend that National Council on Disability ask the U.S. Access Board to fund the U.S. National Building Institute of Building Sciences, NIBS, to revise the 2005 Indoor Environmental Quality Report, EIEQ, on barriers to access and accommodation for people with chemical and or electromagnetic sensitivities. That report needs to be updated. It's been 15 years. Logo for U.S. Access Board and logo for National Institute of Building Sciences. Next. The NCD's health equity framework includes additional component number 6, and we request that it be revised because it speaks to the needs of people disabled by exposure to low-level chemical, electromagnetic, and other environmental exposures. But what is missing is a reference to the electromagnetic sources that are causing harm. Therefore, we request you insert the phrase, as a result of their use of wireless communications technologies. This would ensure the intention is to achieve parity between those who are chemically sensitive and those who are electromagnetically sensitive. Next. That had a logo for the National Council on Disabilities. My next slide is that new building codes will create barriers to access and accommodations. EPA's Environmental Protection Plan supports use of wireless sensors to control lighting, heating, and cooling levels in new buildings and to regulate chemical levels in new buildings. FCC's Digital Equity Plan includes new rules to combat digital discrimination and to promote equal access to broadband across the country. These policy proposals, all with good solutions, have not taken into account what NCD's health policy framework is about, and they will create systemic barriers to access and accommodation for people who are chemically and electromagnetically sensitive to electricity and wireless technologies. Logo for EPA and for the FCC. Next. Furthermore, there is a slide missing. If you wouldn't, well, here we, I think we go back one slide. There's, would you mind? There should be another slide after this one. Next. Okay, I am going to just speak what the next slide said. It says, we ask for all federal agencies, no, excuse me, I'm going to go forward. This is the right slide. I'm sorry. We are calling and we ask you to join us in this call for an independent, sustained, federally sponsored EMF research program. This should involve an all government response, just like the executive order that President Biden signed, which you are responding to with your framework. FDA presently is authorized to be the lead federal agency for regulating electronic products. EPA was the lead agency to develop radio frequency radiation safety limits until 1995 when it was defunded. The research program was defunded. Congress should reauthorize and fund federal agencies to conduct ongoing EMF research and investigations that serve the needs of all categories of disability and to ensure the safety and well-being of workers and the public in the United States. And here I have the logos for FDA, Environmental Protection Agency, and the US Congress. Next. Furthermore, we ask that federal health agencies work with the FCC and with NIST, the National Institute of Standards and Technology, to prepare radio frequency radiation human exposure guidelines that are biologically based or based on the ALARA principle, which means as low as reasonably achievable, on an interim basis until more is known through science. EMF effects on nature must be taken into consideration here. Next. I represent the Electromagnetic Safety Alliance, and we have two projects operating right now. We held a EMF medical conference in January 2021 that was attended by 800 people or more from 30 nations. The program was designed to fill the gap by educating health practitioners on how to prevent, diagnose, and treat EMF-associated illness. We are still offering 2 courses based on this conference for health practitioners who can earn up to 24.5 continuing medical education units, but in fact, anyone can enroll. We would like to offer these courses to National Council on Disability and your colleagues. Secondly, I manage the International EMF Scientist Appeal to the United Nations and all UN member nations, which has been signed by over 240 scientists in 44 nations, who all have published papers in professional journals showing biological and health effects far below the FCC's radio frequency radiation human exposure guidelines. I am working with concerned scientists to publish a paper on this topic very soon. I cannot underscore enough, as the previous speakers have said here today, this is an urgent matter. There are people being harmed. There are people being left out and unable to access not only medical care, but education and other economic venues that would benefit them. They are being marginalized and we need to help them. We look forward to continuing the conversation with you. And I just want to add, I have 3 logos on this page, one for Electromagnetic Safety Alliance, one for EMF Medical Conference, and one for EMF Scientists. Thank you.
Thank you, Libby. Now I'll summarize some of the recommendations that were made today. Revise the indoor environmental quality IEQ report and work with those in the disability community who live with chemical and electromagnetic field sensitivities to ensure our access and accommodations. Coordinate with the Environmental Protection Agency and the Federal Communications Commission about their digital equity plans. The plans of both agencies propose wireless infrastructure that will create new systemic barriers for those with electromagnetic field hypersensitivities. Create a sustainable, federally sponsored EMF research program to serve the needs of people with all categories of disabilities, including those with electrical hypersensitivity syndrome. Thank you. We'd like to open it up for questions now.
Great. This is Andres. Susan and ladies, thank you so very much for the presentation. Let me ask my council members if they have any questions, comments, or reactions. David?
Hi, Mr. Chairman. Yes, thank you. And thank you for the presentation here today. When I was my previous role before I was commissioner of the Mass Commission for the Blind was director of the state's Office on Disability. And unfortunately, many people with disabilities that are experiencing either electromagnetic or because of fragrances are getting discriminated against, not only for their disability, but the nature of their disability. And I just think that's so wrong. And I want you to know I'm with you and I feel for you. And just because it hasn't been in anybody's best interest to study this more fully, to be more conclusive with, data of this causes that. I don't think any of you are saying that, by the way. I think what you're saying is, and for my colleagues, many of the things that they've brought to light here, whether it be difficulty sleeping or whatever, all of the things that come as a result of it, any one of those could be disabling. If you couldn't sleep every night, let's see how long people would function well, and wouldn't be considered disabled. So in the workplace, ask Jan, the documentation that's given out by federal agencies is to accommodate people experiencing this. This is very real. Yes, sure, it impacts a small amount of people, but I just want you to know I'm with you. This is very challenging. I would think the next step for you all should be to get that good, rigorous academic review and or governmental review, either by the NIH or FDA, some government entity, to actually take a stand and say, you know what, this is real and it impacts X amount of the people, differently, and it leads to these other things. So I abhor discrimination, and I know the discrimination that people face, not only because of their disability, but because of the nature of the disability. So thank you for your presentation here today.
Andres, David, thank you for those comments and the sentiments. Mary or Dan, any comments or questions?
May I just say something? Mary, those earbuds that you're wearing are actually wireless. And it's something that we recommend people not do because of the exposure of your brain to that radiation. So you might consider having it monitored to see how high the levels are coming from those earbuds.
Thank you. I wondered about that.
Sandra, Dan, you were gonna make a comment?
Nothing material to add. I concur with David's comments. And interestingly, this has been a bit of a, not a pastime exactly for me, but I do think some of these things are quite interesting because again, they don't make the headlines. So if you're ahead of the curve on these things, maybe at first people think it's maybe of not the most materiality, but there are a lot of people who walk around with these disabilities that, you know, don't make the headlines, so to speak. So commend you and all for your work.
Ladies, this is Andres. I have a couple of questions. Number one, the fact that Ontario has adopted this issue and has addressed this issue legislatively, what is it about the province that is so progressive in this? And how can we replicate that here?
It's a good question. Legislatively, they, for the Canadian human rights and the Ontario human rights, they have to accommodate a disability no matter what it is. If it's an invisible disability, a visible disability, and these environmental sensitivities are considered an environmentally induced disability, which requires legal accommodation. And there's an awareness that from physicians here in Canada and in Ontario that have diagnosed these environmental sensitivities and the disability that it causes. And so that with coupling with educating the hospitals and educating a number of doctors and facilities, they're adopting the need when they see the impact that these frequencies and fragrances have on people to provide access within their facilities. So it's a long road of awareness and education, I think.
I'd also like to add to that is that, sorry, Debbie, I'd also like to add to that we have a hospital here in Ontario where they have a 2-year waiting period for people who want to be assessed. There are too few medical doctors who are doing this type of assessment. And part of what we're doing with the Electrosensitive Society is educating the medical profession. And eventually we'd like to get it into medical schools as well, so that they're trained on environmental sensitivities right from the get-go, and that this is part of their vocabulary. If it's not part of your vocabulary, if you're not aware of it, you're not going to diagnose it. And very often patients are being misdiagnosed. They're given treatments to deal with the insomnia, for example, or the pain, and they just continue to get worse.
I'd like to take a swing at that question, Andres. We have talked about this among ourselves. Why is it that Magda Havas and Sheena Symington are making much more progress there in Ontario than we've been able to make in the United States, dealing with the healthcare delivery system? And this would require a whole conversation on its own, but I think it has a lot to do with the structure of how healthcare delivery is regulated in the United States. The AMA has a very strong role in this, and they are conservative and they do not recognize electrical sensitivity. The Joint Commission on Hospital Accreditation, the Joint Commission is called now, by their own rules, they don't seem to recognize environmental illness or taking precaution and creating safe places. The priorities that are set by the White House Council on Disabilities, NCD, NCIL, don't reflect an interest yet in this issue. We've twice applied to speak at the NCL annual meetings and have been denied, including this year, because this is not a priority issue for them. And I think they're looking towards you in the White House to see what the priorities ought to be too. So uniformly, there needs to be an awakening and more receptivity, plus the money that David mentioned, putting funding into doing a major federal study of this type of environmental illness. so that people can understand the state of the science, the effects, get some numbers, and then start to work on solutions. But we're up against an avalanche of technology that is wireless, that is invading our homes, is permutating every part of society. And so as time goes on, more people are going to be harmed.
Sandra, no, thank you. Thank you for those responses. I know this is, I see this more, what I've been learning about this is with the diagnosis for multiple chemical sensitivities. One, it's not uniformly recognized as a condition by the medical establishment, at least here in the United States. Number two, there's no code for that in medical billing, and therefore, again, it's not recognized as a diagnosis. But oftentimes, and there's very little case law on this, but the case law that exists is in the employment context. And in the employment context, employers tend to view this as a psychological condition as opposed to a physical condition manifesting into a disability. Can you speak to that and how you combat that?
Perhaps I can address that to start with. We've done studies with people who may or may not be electrically hypersensitive. And the type of studies we've done include both provocation studies, where we're testing some physiological function, whether it's brainwave activity or the autonomic nervous system. And we expose them to the radiation blindly, in the sense that they're not aware of when they're exposed, and we're simply monitoring their physiological reaction. And some percentage of the population, in our research, it turns out to be about between 30–35% roughly, react to this radiation. So some people have heart palpitations, and we can pick that up quite easily. And they're just sitting there, and their heart beats about 65 beats per minute. We turn on the radiation from a Wi-Fi router or from a cordless phone, and within seconds, it jumps to 100 beats per minute, and they're not moving, and they feel anxiety. So they're going into a fight or flight stress response physiologically without being aware of it cognitively. This is not psychological, it's physiological, that has eventually psychological consequences.
And
Yeah. Please go ahead.
I'd like to add that you mentioned the diagnostic codes. There is a diagnostic code now for electrical injury in the International Classification of Diseases, initiated by the World Health Organization and adopted by the U.S. Department of Health and Human Services. The W90 code does cover electrical injuries. And then if you add code modifiers to describe the type of radiation, whether it's electricity or wireless or something else, and the duration of exposure, whether it's rapid onset or chronic, you then have a disease code. And we are telling people to use these codes. Secondly, my doctors, I speak to them all the time, and they have the impression that in order to have electronic record keeping, they need to have it wireless. So that means their offices must be wireless with Wi-Fi. And I have difficulty understanding that, whether maybe that's a condition of signing up for electronic record keeping, but this is so embedded now in our healthcare delivery system. It's going to take time to change it, but we need to start now.
Great. Okay. So Malloy, I'm going to give you the last comment here.
Thank you. I'd like to make a point now that I didn't make during my own presentation that is real close to my heart. That is that many of us with multiple disabilities have as the trigger for the symptoms of all of them, electrical exposures, Wi-Fi exposures, chemical exposures. Without those, we might be in much better shape. Also, the folks who have a disability and recognize it and acknowledge it, and their doctors know about it, might be experiencing less problems with it if they unplugged, didn't sleep right next to the battery for their wheelchair. They're just all kinds of things that we've learned, and our being isolated from the rest of the disability community doesn't serve any of us. We're awfully concerned about the use, I think, overuse of Wi-Fi and technology that's unshielded for some of our colleagues with different disabilities too. Thank you.
Susie, I appreciate that, ladies. Thank you for the presentation. Thanks for coming and sharing this critically important information with us. I can assure you it's not going to be our only conversation with you, and we hope to have a conversation soon on what we can do internally to try to help address this issue. So again, thank you so very much.
Thank you.
Thank you.